The rate of blood flow through the lungs is determined by cardiac output. The right ventricle pumps deoxygenated blood into the pulmonary artery, which delivers it to the lungs. In the lungs, a network of capillary vessels surrounding the alveoli facilitates gas exchange, including the uptake of anesthetics. The anesthetic is then carried in oxygenated blood via the pulmonary vein to the left atrium, and subsequently pumped by the left ventricle into systemic circulation. Cardiac output is therefore responsible for pulmonary blood flow, which governs anesthetic uptake, as well as systemic blood flow, which distributes the anesthetic to peripheral tissues, including the brain. Increased cardiac output appears to enhance the delivery of anesthetic to the brain via systemic circulation, therefore increasing the speed of induction. However, it also increases the uptake of anesthetic from the alveoli into the blood, thereby reducing the alveolar partial pressure. Since the difference in anesthetic pressure between the alveoli, blood and brain is the primary factor that drives its diffusion, the anesthetic will enter the brain more quickly when alveolar pressure is high regardless of the brain's blood flow as long as the gradient exists. So the effect of increased cardiac output on uptake takes precedence over blood flow to the brain, leading to slower onset of anesthetics. With reduced cardiac output, less anesthetic is taken up by the blood, causing the alveolar partial pressure to rise more quickly. This results in faster equilibration between the alveoli and the brain, leading to a quicker onset of anesthesia. However, if blood flow to the brain is also significantly reduced, it can counteract the rapid rise in alveolar partial pressure by limiting the actual delivery of anesthetic to the brain. Ultimately, the balance between reduced systemic blood flow and the faster rise in alveolar partial pressure determines the onset of anesthesia, with the latter effect typically being more dominant. Both during increased and reduced cardiac output, there is a feedback mechanism that helps regulate the uptake of anesthetic to maintain a balance in the rate of delivery to the brain. With higher cardiac output, at the start of anesthesia, there is an increase in uptake of the anesthetic into the pulmonary circulation. As the anesthetic is absorbed rapidly, it lowers the alveolar partial pressure since the blood is quickly carrying the anesthetic away. This reduces the concentration gradient between the alveoli and the blood, slowing the rate at which the anesthetic moves from the alveoli to the blood and the brain. This feedback mechanism works to slow down further uptake of the anesthetic, allowing the alveolar partial pressure to rise as more anesthetics are delivered from inspired gas. With reduced cardiac output, less blood flows through the lungs, meaning the uptake of anesthetic into the bloodstream is slower. Because less anesthetic is absorbed by the blood, the alveolar partial pressure increases more rapidly with inspired gas. This increases the concentration gradient between the alveoli and the blood, which speeds up the transfer of anesthetic from the alveoli to the blood and to the brain.